I was seeing a couple for a fairly long visit about a new complicated diagnosis. It was going to require that they get specialty care in a couple different places in addition to my primary care. We made a plan, and at the end of the visit, I reminded them that our medical record system in this country is fractured and not very responsive, and that they needed to steward their own information. I told them to ask for a copy of every test, every x-ray, and every note or letter, and organize it in a binder. Bring it to all their visits, because that was the only way they would be sure that each person saw what the last person did. And on the way out, my patient's wife smiled at me and nailed me to the wall. She said, "So how do we get a copy of your note?" And until that day, I had never given a patient a copy of their note that I could recall.
Mm-hmm.
So that night, when I was doing their note, I had a somewhat different mindset. I was doing the note knowing I was going to be giving it to them the next day.
Mm-hmm.
And I realized that my usual phrasing, the way I usually did the note, it was my note about my visit. It was entirely my perspective on the interaction. And to the extent that the patient appeared in the note, it was always third person. The patient says, the patient denies, the patient exhibits, all these medical phrases that clinicians are so fond of using. And I was uncomfortable with that, and I wrote that note differently. I used we a lot. We decided to do this. We decided this was important, and that felt different. I thought about that, and I resolved that, okay, I'm going to try to write my notes as if the patient is going to look at them.
Mm-hmm.
Of course, as if is one of those powerful phrases.
Mm-hmm.
You can do anything with as if.